hot flashes and night sweats, we used to just think were a silly bother and nothing to really worry about. But more and more, we're starting to understand that these symptoms may be an indicator of women who are at higher risk for heart disease later. So they're not necessarily benign symptoms. And we're starting to learn that certain patterns of hot flashes are associated with higher risk. For instance, some studies in women's health have identified that those women who have hot flashes earlier, even before the last menstrual period, may be at higher risk for heart disease later. Not all studies show that same timing association, so there's more to learn there. But we know that it's probably not the hot flash itself that is the high risk for heart disease, but it just may be a marker for those women that have a higher risk. So that's one point. So menopause symptoms are not necessarily benign. We've known for a long time that high blood pressure during pregnancy is associated with high blood pressure after pregnancy and a higher risk of heart disease. So we've known that for a while, but we didn't know that these two things connected. What is still unclear, and what I hope this study can sort of lay the groundwork for, is determining whether a woman has one risk, or one of these, like high blood pressure during pregnancy, it might increase her risk a little bit, but we don't know if she has both of them, a high blood pressure during pregnancy and bad menopausal symptoms, if that risk is additive then. And so hopefully this study will inform some additional studies down the line that can help clarify that a bit more. In general, we really don't have good risk prediction models for women and heart disease. And so if we could make it a little more precise about which women are going to have a problem, then we can intervene earlier. So that, I think, is a takeaway. The third takeaway is that if we can predict which women are going to have a harder time in menopause, we can be better about educating them before they go into menopause. You know how women get the talk before they start their periods, and they get all this education, or I wouldn't say women, they're girls then. They get this education about what to expect and what to do. We do a terrible job of educating women who are about to stop their periods at the other end of their reproductive life. And guess what? They have just as many hormonal fluctuations and just as difficult a time. So if we could say, you know what, you're at risk for having a worse time during this phase of your life, and here's some things that you could do about it, wouldn't that make things easier for women? If women themselves would recognize that high blood pressure during a pregnancy puts them at increased risk for heart disease later, they can advocate for better screening. I think women tend to get lost between that time that they have a pregnancy and deliver a baby, and then come around at midlife and nobody really asks about what happened during a pregnancy to assess their risk. So I think if women can really say, you know what, I had this thing back when I had a baby, does that mean something for me? So if women can advocate for themselves, it would be great. Same thing with regard to menopause symptoms. I think so often we tend to blow those off for women, and I think women need to be self-advocates here and say, I am not having a good time. I am having trouble functioning. I can't sleep. My mood is terrible. I'm hot flashing all the time. I can't focus. You know, if that's happening to you, there are treatments out there. There are things that we can do. And we shouldn't just be sort of patting women on the head and saying it'll all be over soon, because guess what? The mean duration of these symptoms we now know is 7 to 9 years. So it's not exactly a short time.